Hi everybody, my name is Sinéad O'Flynn and I'm here to tell you about Health for You and the services that I offer. But first I want to give you a bit of a background about me and where I've come from and where my passion with nutrition has come from. So I'm married and we have two amazing children who keep us busy and keep us on our toes, and we have a lovely little doggy who also keeps us busy and on our toes. We've had our own kind of struggles with our family, and we had some fertility issues, and then we had two miscarriages which were absolutely devastating. But we're very grateful and thankful that we have our two amazing children now. We have some autism in our family, which has brought so many amazing things into our home and so much amazing understanding and empathy. It obviously comes with its challenges, but what we have gained over the years has been amazing. Has really opened our minds, and that's really kind of, I won't say too much more on that because it's not my story to tell. But basically, from my perspective, I have come from, I've been a nurse for over 20 years, and I've worked in many different specialities, and I guess that's where my passion with nutrition came. So I would have worked in gastrointestinal disorders, so inflammatory bowel disease like colitis and Crohn's, or people who had stomas, for say bowel or bladder cancer, or maybe diverticular disease. So I've worked in the hospital in the acute setting and out in a community setting, and nutrition would have been a huge part of my role to provide that guidance and support. And I guess that's where I got my passion from. And I guess I've often felt in nursing that there's times you just don't get that time to give that full support and guidance to people, because nutrition again is such a large area, like any other area, to try and guide somebody through. So I've also worked in areas of cardiovascular disease like cardiovascular risk reduction, and respiratory clinics and like asthma and COPD. And I've worked as a research nurse, and my most recent research role was in the area of the microbiome, which I find fascinating, that link with the brain and the gut. So I've got my own health issues that I've had over time, and I have an autoimmune disease. It's Hashimoto's, which is to do with an underactive thyroid. And basically I've suffered for a lot of my life with irritable bowel syndrome, and I've probably always had some sort of hormonal imbalance, but certainly that has increased over the years. And I suppose since my childhood, since we started on our childbearing years. So nutrition, I guess, for me was where I found that I helped to improve my symptoms, and I started to live so much better quality of life and started to feel so much healthier. And I guess then I decided that I wanted to study nutrition, and I decided to study naturopathic nutritional therapy because it looks at the whole person. So it's holistically looking at you. And your symptoms, any illnesses you have, your family past history, any medications you may be on, your lifestyle. So it's looking at the whole lot, and it's trying to find the root cause and not just treat symptoms on their own, which is, I suppose, typically what Western medicine will do. So basically, if you come to me for a consultation, the initial consultation takes about an hour and a half, and it's a very detailed assessment, and that's because I'm trying to gain all that information for you so that we can help to develop the best plan for you. So we work together to develop that plan, that what will work and what's achievable and attainable for you around your lifestyle, and whatever work or stresses you have going on in your life, trying to help improve them, but to make it manageable, because there's no point in attempting to make a change in your life if it's not attainable for you. If it's not manageable, it's not going to work, and in the long run then you're going to end up with more stresses trying to figure things out. So basically we go through like quite a lot of your medical history and your past family history, and we go through all the different systems, your GI system, your nervous system, your heart system, your skin, your autoimmune. So looking at everything, looking at what you work at, looking at the stressors that are in the environment around you, looking at your lifestyle and any interests and hobbies you have. So then I go away, and it takes me a couple of hours to go through all the information. And while I'm developing a plan for you, I will be looking to see anything that I may be advising you, whether it's to increase, vitamins or minerals, whether that's in a nutrition form or through supplements, to make sure that it's not going to interact with any medication you're on or any illnesses you have, because we can have contraindications with vitamins and minerals, the same that we can with medicines. So I need to check over on that before obviously we go through your plan. So then we'll go through a feedback session where I go through the nutrition plan with you and make sure that you're happy with everything and something you feel is attainable. And then in about 4 to 6 weeks, you come back for a follow-up review. And we'll have listed some of the symptoms that you have at the initial consult. And so we'll revisit them in the follow-up to see and measure how they are. So to see have you got improvements or if you don't. And then look to see how everything went, what worked and what may not have worked. And if you've any new symptoms, if there's anything else that you need to work on. And then I'll go away again and develop up a new plan, looking again through everything, over a couple of hours to see what changes we may need to make, and again checking contraindications, that nothing is going to be contraindicated with anything that I'm going to be advising to you. And then from there, obviously we'll take it from there. Sometimes people may need further follow-up. Again, it's obviously an individual decision. That's down to you, to how you feel. This is a lifelong change. It's not, a quick fix. So it's like when I would, attend maybe an osteopath or a chiropractor, it's important to maybe have a yearly review of these things to kind of keep you on track. The same way we should be having health checkups with our GP and our dentist, or any specialist that you may be seeing, just to make sure that everything's running okay as such, because I guess we can often kind of fall back into habits, and we may start getting symptoms and we mightn't even realise that actually, I'm back eating something or doing something that I had stopped doing that had improved me. And it's, it's about somebody else, I guess, looking in and seeing that and just giving you the support and guidance, because I know myself, I need that support from somebody, or somebody just to look in and tell me it's probably something that I already know, or it may be common sense, but I may not just be seeing it. So again, that's really what it's all about. So I'd love to meet with you if you're looking for some help and support. So if you'd like to contact me, you can have a look on the website or Facebook page, Instagram or Twitter, and either send me an email or give me a call or send me a text message or WhatsApp, and I will phone you back and we can go through everything and we'll go from there. And I very much look forward to meeting with all of you. And look, here's hoping. We're lovely and sunny here today, the last couple of days. So here's looking to hopefully meet you soon. Bye. Thank you.